now we're going to see the uses of bronchoscopy. Bronchoscopy is a endoscopic technique in which the tube is advanced through the mouth, nose, or tracheostomy. The bronchoscopy can be flexible or rigid. The rigid bronchoscopy is used for foreign body aspiration or management of advanced airways. And the risk of doing the rigid bronchoscopy is damage to the lips, teeth, or tongue, and rarely pneumothorax. Now, the flexible bronchoscopy is helpful for bronchoalveolar lavage, in endotracheal biopsy, bronchial brushing, transbronchial biopsy, endoscopic bronchial ultrasound, or final needle aspiration. The bronchoalveolar lavage, here we, through the endoscopic tube, also we put saline infusion, and so what we are acquiring on the bronchoalveolar lavage is the bronchoalveolar lavage, is the lavage of the bronchoalveolar structures, and the indications for this would be non-resolving pneumonia, diffuse pulmonary infiltrates in immunocompromised patients, or diffuse non-infectious diseases of the lung and suspected hemorrhage. For the bronchial brushing, here we're taking a sample of the lung tissue, of the bronchial tissue, the brush border, to assess malignancy and infectious diseases. The transbronchial biopsy, this is less invasive than open biopsy, and the indications are lung nodules or pulmonary nodules, infectious diseases in immunocompromised patients, or acute allograft rejection in lung transplanted patients. The final needle aspiration is to assess the mediastinal lymph nodes to see if there is malignancy or metastasis to the lymph nodes, and the endoscopic bronchial ultrasound. This is a ultrasound in conjunction with a bronchoscope, and the indications are endobronchial lesions, staging of lung cancer, mediastinal lymphadenopathy, or intrapulmonary nodules. This is done to visualize the wall airways and surrounding structures. So bronchoscopy is a endoscopic technique that we pass the tube through the mouth, nose, or tracheostomy, and could be rigid or flexible. The rigid is to assess the distal airways or management of the distal airways and foreign body aspiration with carefulness with pneumothorax, lip, teeth, or tongue damage. And the flexible bronchoscopy is helpful for bronchoalveolar lavage, bronchial brushing, endotracheal biopsy, transbronchial biopsy, final needle aspiration, and endoscopic bronchial ultrasound.